can we remove a pilonidal pilonidal cyst? So a pilonidal cyst and a pilonidal sinus are kind of similar sort of things. So a pilonidal cyst is, I mean, I normally say we can remove cysts from any part of the body, but then people always ask certain parts of the body and always think, actually, no, not that one. And this is another one. It's not a question of can we remove it, it's that we wouldn't be probably the right people to remove it. So a pilonidal cyst or a pilonidal sinus is something that happens at the top of your natal cleft, so over your coccyx, over your tailbone, the cleft of your buttocks, just at the top of the cleft of your buttocks. And it's usually caused by a little ingrowing hair, and it's often from hairs from your back that fall down into that cleft and work their way in to form a little cyst, a little lump. And it used to be called Jeep driver's bum because it was very common in the army and people who drove the Jeeps. It's nowadays, it'll be, I guess, truck drivers would get them. You can also, hairdressers sometimes get them in their hands, in their web spaces for the similar reason. Little hairs grow into the skin and form a little cyst, and they're actually quite difficult to treat, and they often get infected, particularly the ones on the buttocks in between the natal cleft. They can get infected, and they can require, usually the treatment involves opening them up, kind of laying them open, we would say, and packing them, and then changing that pack every day as the pack gets less and less. And that would normally be a general surgeon would be involved in that rather than a plastic surgeon. So as a general rule, we wouldn't get involved in removal of pilonidal cysts or pilonidal sinuses. That would be a general surgeon who would do